Welcome back to part 2 of chapter 31 lecture for ALH3. We only have a couple slides left, and we left off on anabolic steroids. So we're going to look at the effects in females, which are decrease in breast size, decrease in ovulation, lactation, and menstruation. And in males, we actually see an increase in breast size, testicular atrophy, and priapism. We also see a decrease in sperm production and sometimes impotence. Make sure you look at table 31.1 for the length of time from which a drug can be detected in the urine. This is also part of your assignment this week on Canvas. So you'll be looking at this and also including it in your notes or your study document this week. Abuse and misuse for patient education. The best education is teaching prevention of medication abuse and misuse. Like we talked about earlier, it truly can take one time of trying a drug to get to the point where you have a physiological need for it and you start to misuse and abuse. So, of course, we want to stop that from happening from the beginning when we're educating our patient. All health professionals have responsibilities to assess medicinal situations and to teach patients dangers of these problems. Again, like we discussed earlier in this lecture, it's very important that your patient does not feel judged and that they feel that you have an understanding and are able to communicate their thoughts with you. The healthcare professional must have a thorough knowledge of the psychotropic drugs, their actions and side effects, so that they can help their patients. And symptoms of specific abuse drugs are here on 31.8, so please take a look at this as well. Have a great day, and I'll see you in class. Bye-bye.